So you've already mentioned, I think, some clinical conditions, but let's just clarify. What are some 3 clinical conditions that you think FMT is ideally suited for? And then give us a little tidbit on each of those.
Great. Well, the most strongly evidence-based one is antibiotic-resistant Clostridium difficile infections.
Right.
It is pretty solidly 90% curative in that population. These are people who have failed metronidazole, they've typically failed vancomycin and or fidaxomicin. These are the only FDA-approved therapies, and it saves their lives and reduces colectomies and reduces suffering and reduces hospital costs. Big win there. There is emerging evidence that it may be the best intervention for early severe or fulminant C. diff infections. So even if they haven't failed rounds of antibiotics, it probably saves lives to give it earlier on. Okay. The American Gastroenterology Association interprets the FDA guidelines to say, well, not responding to standard therapies means you've failed at least 3 rounds of antibiotics, at least one of which has been vancomycin. I interpret it differently. I say, if you have failed a single round, then you're eligible for FMT at my clinic, and that's what I encourage other clinicians to interpret the guidelines to mean as well. So yeah, we have good meta-analyses and a couple small randomized controlled trials that give us solid evidence that FMT is great for refractory C. diff.